everyone. There may be a few people still joining as we get started. My name is Hiltrud Dawson. I'm one of the health promotion consultants with the Best Diet Resource Center. Again, welcome everyone. Your lines have been muted, and there will be a little bit where we have discussion time and question and answer. It's probably easiest to do that on the chat line, but please, and also please let me know if you cannot hear. So if there's any problems with your audio or you don't hear me well enough, please let me know. Just use the chat box. We may unmute the lines when we get to the discussion period. So this is our webinar on reproductive life plans. For those of you who are here, I take it that you're all interested in preconception health and reproductive life plans. And it should be an interesting webinar and hopefully some discussion with it as well. As I said, I'm Hiltrud Dawson. I'm one of the health promotion consultants for the Best Diet Resource Center. I've been with the Best Diet Resource Center for about 11 years, actually. Yes, it's into my 12th year by now. Time flies. All right. Okay. So I want to tell you a little bit about who we are, the Best Diet Resource Center. We provide information, consultations, resources, and training in areas of maternal health and early child development. And we do this for service providers. We are a program of Health Nexus, our parent organization, and we are funded mostly by the Ministry of Children and Youth Services. And we do often have other funding pockets for different projects that we're involved in. We do have listservs, bulletins, and web watches that you probably belong to or have seen at one point or other. Please, they are for your use and make use of them. They provide you with lots of information about not only what the Best Diet Resource Center does, but also what's happening across Ontario, Canada, and beyond. We develop resources on child development, environmental health, nutrition, postpartum mood disorders, reproductive health, and a number of other topics. We do consultations on-site and off-site, and we offer training through regional workshops and our annual conference, and actually also through webinars, which we are doing right now. So we have the attendance list along the side, but I'd like to know who is there, and if you can do this right while you're there, that will help me make sure that the people who registered are also attending, and to know where you're from. And if you can click on your name, and you can probably edit the attendance option there. So click on your name, and if you've got your first name and last name, you can add there @organization and then the number of participants. So if you're sitting with a group of co-workers around a phone, then, and you know, maybe there's 4 of you or 3 of you, you can put that in there. That would be great. Yes, okay. So here's again what I just said. So for example, if I was here with 2 of my co-workers, I would put in Hiltrud or Hiltrud Dawson at Best Diet Resource Center and then 3 attendees. So if you can put that in, that would be really helpful to me, and if you don't, that's okay as well. All right, let's move on to our learning objectives. We are planning on reviewing the concept of preconception health. We're going to review reproductive life plans as one strategy to improve preconception health. We're going to discuss strategies to disseminate reproductive life plans among various sectors. And we're going to consider strategies to mitigate health disparities when using the reproductive life plans with various populations. So it seems like everybody's okay. You can all hear me okay. I haven't heard anything to the contrary. So we can keep moving along. So why preconception health? What's so important about preconception health? What is preconception health anyway? So according to the Center for Disease Prevention in the U.S., preconception health refers to the health of women and men during their reproductive years. It focuses on taking steps now to protect the health of a baby when they might have sometime in the future. The benefits of preconception health are for better birth outcomes and improved overall health for all adults throughout their lives. Another really important document that you can look up at some point is the SHIFT document, and I'll show that to you in a few minutes. And according to the SHIFT document, 8.1% of infants in Ontario are born preterm. The rate is the second highest rate after Alberta. So we have a fairly high low birth preterm birth rate in Ontario. And it hasn't really changed substantially. So what can help with this? One of the things is definitely preconception health. And to improve birth outcomes in Ontario, we need to just know, first of all, what we're looking at. So as I said, Ontario has a rate of 8.1 preterm birth. 6.6% of babies in Ontario have low birth weight. Birth defects, including neural tube defects and FASD, are still happening. And there is infant mortality rate in Ontario of 4.6 infants per 1,000 live births. So that's 0.46% if you want it in percentage. The infant mortality, or all of these stats, were taken from 2010 to 11. So there is association between preterm birth and multiple pregnancies, maternal diabetes, maternal hypertension, and maternal age less than 20 or greater than 35. There's an association with smoking, with illicit drug use, maternal stress, pre-pregnancy weight, low or excessive gestational weight gain, women with low income who experienced reduced overall health status, 1 month prior to becoming pregnant. So there's quite a link to different maternal considerations, and we just want to examine that a little bit more. There are some emerging trends as well. Advanced maternal age could possibly be one contributor to the rise in maternal mortality, but also in low birth weight, not so much low birth weight, but preterm birth. Maternal obesity estimated at 39.1% of women of reproductive age. That wasn't just the obesity rate, but obese and overweight in 2012. This is linked to birth defects. Excessive weight in pregnancy is associated with preeclampsia, gestational diabetes, gestational hypertension, cesarean section, small or large for 8 babies, overweight and obesity in childhood, and of course all of these can impact on birth weight, birth gestation, so preterm birth. And poor mental health before pregnancy is also more likely to have pregnancy complications. Almost 50% of women with mental health problems prior to pregnancy are more likely to have a non-live birth and nearly twice as likely to deliver a low birth weight infant. So definitely some risks there, and trends that are emerging, trends that are continuing. Maternal age has been increasing for some time. Maternal obesity has been increasing. Mental health is probably not increasing, but we're becoming more aware of all these and how all these factors impact on a pregnancy and the outcome of a pregnancy on baby and mom at birth and from there on. So a really, really important document that you may want to take a look at. It is available online, was done by the Ontario Public Health Association, the Reproductive Health Work Group, specifically the Preconception Work Group within that, called SHIFT. sorry, my cursor didn't want to move there along with me. Okay, so shift enhancing the health of Ontarians, a call to action for preconception health and preconception care. It was released in 2014. As I said, it was authored by the work group, and it is a good read and really gives you a really good background on preconception health. Okay, I don't know why that, all right, unplanned pregnancy. I don't know why there's a little picture here that did not come up. So unplanned pregnancy, we have about half of pregnant women who are planning a pregnancy, or half of the women in the adult, in the reproductive age, half of the pregnancies are planned and about half are unplanned. So there's a lot of women who are not aware of thinking about preconception health necessarily. Those who are planning a pregnancy may be more aware of issues and health risks and considerations and steps they can take to prevent anything, but those who are not planning may actually not be aware of those at all. Oh, here we are. Here's my little thing. So we have about half of women planning and half of pregnancy unplanned. Preconception health is but preconception health is not only for people who are planning a pregnancy. Preconception health is for women and men, whether they're planning a pregnancy or not planning a pregnancy. It is to ensure that they're at their best health within their reproductive years, so that they ensure they have a healthy, well baby in the future if they decide to have one. So then let's take a look at what is a reproductive health plan. So we're going to go to our first poll. Nope, this is not the one I want. How familiar are you with a reproductive life plan? So here's some options, and I'll leave you to for a few seconds to vote on these. Yeah, we're getting quite a few different things. Okay, we probably have had pretty much everyone voting. Still a couple to come? Or you're not deciding quite around the table? Of course, when you're in a group, it's a little bit more difficult. So anyway, we're going to close the poll, and let me show you what we've got here. So the first question, the question was, how familiar are you with the reproductive life plan? First answer would be, I know very little about reproductive life plans, and we have about 25% of those here who are voted for that. I have seen and reviewed one or more reproductive life plan. That's quite a high number, 55% here. I have used the reproductive life plan for myself. Surprising, no one has. So I don't know if that means that, you know, we didn't consider them applicable to ourselves, or they weren't around when we needed them. And then we have 18% who've actually used the reproductive life plan with clients. So very interesting results there. I do have another poll here. No, we're not going to do that right now. We're actually going to do that slightly later. So let's go back to our slides. Okay, so what is a reproductive life plan? So let me tell you a bit more about that. A reproductive life plan, according to Mallory Johnson from 2011, a reproductive life plan represents the intent to or not to reproduce. The reproductive life plan identifies the needs of each individual depending on his or her stage of life, and takes into consideration future intent, timing, and number of pregnancies. And that doesn't mean to say that somebody who has made a reproductive life plan can't change their mind, because especially in the younger women, you do get that life circumstances change and they may change their mind. But it does help them to look at those kinds of things in a broad perspective, and in a perspective that fits with their own goals and dreams and visions and hopes. A reproductive life plan can be a sentence that helps you decide if and when the time is right to have a baby. So now we're going to take at the 2 reproductive life plans that were developed by the Bestard Research Center. I was quite involved in the first reproductive life plan, which is the one you see on the left. It's called My Life, My Plan, and it's meant for youth. So this is for young people ages 15 to 19 kind of thing. And then on the right, we have the My Reproductive Life Plan that was developed for adults. So basically sort of the 20 on group, this life plan would be for. Both plans are available as PDFs and as fillable PDFs on our website, so individuals can complete the booklets online and save or print a copy with their responses. They can also print it first and then do handwritten pieces in it. The My Life, My Plan consists of 6 topics. So there is, it does not specifically focus on reproductive life plan or sex, because this is for youth. Instead, it's a booklet that helps teens think about setting and achieving life goals and ultimately a life plan, including making healthy decisions. The booklet guides the user through 6 topics, and each page provides space to enter notes, goals, and plans. Each section also contains facts and resources. So the My Health, that's the first topic, asks questions about physical health, including eating habits, physical activity, immunizations, body image, and substance use. My Mental Health asks about relaxation strategies, sleep, altruism, and support systems. My Relationships asks questions about friendships, level of socializing, relationships, healthy relationships, and sexual activity. My Reproductive Health asks questions about intention to be a parent someday, how many children and when, teen parenthood, STIs, and unplanned pregnancy. My Family Health History recommends teens to find out about their family history of disease, mental illness, premature babies, or babies born with birth defects in the family. And the last topic, My Future, guides the youth through planning for their future, including identifying interests, setting goals for the next year, next 5 years, career aspirations, and what level of education is required to meet these goals. So here's a page from the Reproductive Life Plan. As you can see here, it talks about, do I want to be a parent someday, how many children would I like to have, and when, how would a teen parent affect my other goals, what is my plan to prevent an unplanned pregnancy, if appropriate, what kind of protection from sexually transmitted infections and unplanned pregnancy, if appropriate, do I choose. So you can see here that things are covered in a very sensitive way so that it meets the needs of teens from different cultures and different religious backgrounds and with different ideas. And it usually includes a few good quality websites where you can get more information as well. Here's a fact that's on this next page there. So STIs fact about STIs, and again, a website given where it's from, kidshealth.org, so they can get more information from that. And who will I talk to? Doctor, nurse, counselor, parent, if I have questions about my sexual health. So it gives some options to do those. So now that we've looked at the one reproductive life plan, the other one is, we'll look at that in a few minutes as well. We want to talk a little bit about the dissemination of this one. One of the chief considerations is how to disseminate the reproductive life plans, and in particular, we're going to talk about the adult life plan. But first of all, let's take a look at this. So the Youth Reproductive Life Plan, there has been some effort already made to get it into school boards. In several jurisdictions, public health units have successfully advocated for the Youth Reproductive Life Plan to be incorporated into the curriculum at the board level. For example, one board approved the use of the My Life, My Plan booklet for its health and physical education curriculum for grades 9 to 12. The plan was to have hard copies of the resource distributed to all the board secondary schools in the fall of 2016. And I haven't heard if that's happened yet, but I'm hoping it has. Another after-school program for youth has adopted the use of the My Life, My Plan in all their locations. So school boards, youth programs, I don't know if you would like to, actually we're going to take a few minutes here for you to write in the chat line if you have any ideas or if you have already done any of this, if you've used the Youth Reproductive Life Plan booklet and have any thoughts about how it could be used, any experience of its use. So we'd love to hear a little bit from you. So we're just going to give this a couple of minutes. Somebody's typing. So the question there is, would you be able to share which school board used it? So I have to find out for you, but I can certainly share that. Yes, and again, that's this question from two people. So, and then Shelley and Christine are sharing that they have used the Reproductive Life Plan and have been asked to come into the school parenting classes. That's really great to hear. Robin and two others say they've used it in sexual health clinics. And Robin, was this the youth plan or the adult plan? And Johanna, I've presented the Reproductive Life Plan, I think, resource to high school teachers during a PD day. That's really great as well. So Robin said the youth plan. Okay, here we've got another question. Hastings Prince Edward has adopted the My Life, My Plan booklet for use with our school board, and we have developed 5 lesson plans. Wow, that's really great, and teacher resources to go along with it. We're in the formatting stages and hope to have out of schools grade 9 class soon. Okay, we also have a plan to evaluate with teachers. That's really great. So Holton is joining just now. Is the resource link to the OPJ website? No, it's on the Best Start website. Both reproductive health life plans, the youth one and the adult one are on the Best Start website. There's a few more people typing. I'm just, while you're typing there, I'm just going to go to my yeah, it's all good. We're just going to go back to the sharing for the moment being. So, okay, so maybe we'll continue doing our slides. And we'll talk a bit about the adult reproductive life plan, and then we can talk more about dissemination for both of them, because that's going to be a big part of our discussion. So the My Reproductive Life Plan, this now is the adult plan. I quite like the two titles. I like the My Life, My Plan. It just sounds like, youth. And then the My Reproductive Life Plan is much more the adult version when they're focusing on the specific topic. So 7 topics this one has. It's designed for adults who want to have children someday but not right now. Adults who are not planning to have children, who are ready to have children now, are directed to other resources. So My Reproductive Life Plan provides several options for a reproductive life plan statement. For example, I'm not sure if I want to have children, so I will. And then several different ones. My Physical Health asks questions and provides information about managing chronic disease, immunizations, multivitamin with folic acid, medications and supplements, healthy weights, physical activity, and healthy eating. My Sexual Health asks about a plan to prevent and screen for STIs and provides information about healthy sperm. My Mental Health asks about support systems, relationships, stress, and sleep. My Family Health History encourages individuals to learn about their family's history of health problems. Planning when to have children gives facts about the impact of advanced age on fertility, fertility problems, and birth spacing. My Next Steps allows the individual to create their own next steps to meet their life and reproductive goals. A resource list of websites and organizations on a variety of topics is also provided. Before we move in, I'm just going to move on. I'll just read you Kathy's answer here, or to the discussion contribution. The Toronto District School Board has approved the resource. We're still working on distribution with them. However, school liaison nurses and sexual health nurses are promoting it in their high schools at health promotion events and classes. Well, that's really great, Kathy, and a big school board to have that approval from. So what a good example that can be in other areas as well. So it's really great. So here you can see a little bit from the reproductive health plan, the adults. My Sexual Health, taking care of your sexual health can improve your overall health, protect your fertility, and improve your chances of having a healthy baby. And then a little bit of STIs and some tips. Everyone should have a plan to prevent sexually transmitted infections. So good, simple, clear, concise statements, information that can easily be, can people think about and hopefully make some decisions about. A little bit for men here too, healthy sperm. Men don't always realize that their health is important for a healthy pregnancy. It takes about 3 months for new sperm to fully develop. Drinking alcohol, smoking, tobacco, taking certain medications, exposure to industrial chemicals, too much stress, and being overweight can make it difficult to make healthy sperm. So again, just like in the Youth Reproductive Health Plan, there are facts there. So this would be a fact for specifically geared to men of the reproductive age. So now let's take a look again at how can we disseminate the adult reproductive life plan. Okay, let's go to a quick poll first. So which stakeholders would you connect with to disseminate the adult reproductive life plan in your community? So I'll give that a minute for you to do some voting on this. Okay, I think we're just about done there. And let's see what we've got. So the question was which key stakeholders would you connect with to disseminate the adult reproductive life plan in your community? So lots of people want to connect with primary care. So of course you can only choose one, and you may want to choose more here. But let's see what's the important ones. Primary care, 26%, colleges and university, 33%, sexual health clinics, 22%. No one thought that it should go to recreation centers and sport facilities. That probably just means that that wouldn't be the highest priority. Community centers, 15% that. And then there are 3.7% who put down other, actually one person. And maybe whoever that was, would you mind writing your comment in what the other would be? That would be interesting to hear. So let's take a quick look at the different options here where we can disseminate. So we're just going to go back to our slides. Okay. Primary care. So that's our first option. According to Mallory and Johnson, well baby visits and immunizations are an ideal time to discuss reproductive life plans. Now that doesn't seem to be the right thing, because often people don't think of that as preconception health, but this is interconception health, and it's just as important as preconception health. The Center for Evidence-Based Practice has developed a preconception health care tool revised in 2015 for healthcare providers, and it includes a referral to create a reproductive life plan. So it's a really good time to do that, but of course we don't want it only during that interconception period. We want it preconception as well. So it's good to do that kind of talking before people get pregnant. Preconception health should follow a life course perspective, and it's expected that an individual's reproductive life plan will change over time. Healthcare providers can prompt conversation about preconception health on an ongoing basis. So, you know, I don't know if you have any experience or ideas on how that can be brought in early on before people even really you know, are at the actual brink of planning a pregnancy, but to do it early on, like throughout the time with their primary care provider. So as I say, these are some ideas here, and we can discuss these all a little bit more. So sexual health clinics are a good point to talk about sexual reproductive life plans. There can be another location where preconception health and reproductive life plans can be promoted. If there are existing printed format, then they could be available there, or, you know, like a little card with a website or whatever to access them could be good. So these can definitely be used to sexual health clinics, because here's people already thinking about that topic, at least one aspect of reproductive health. So it doesn't take very much to really make that second step and think about a reproductive life plan. Colleges and universities, there were lots of people who thought that were a good place to really start. The adult reproductive life plan will be promoted among college and university health clinics and peer health promotion programs, or at least it should be, but how are we going to do that? I don't think we have any direct plan for that, and it'd be interesting to see what you come up with, how you can approach them, how you can get the plan into colleges and universities. It might be easy to get it into a nursing class, but it might not be so easy to get it into an engineering course or somewhere like that. So I'd be very interested to hear your ideas on how that could be done. We also had, let me just go back a couple of slides to see what the other options actually, no, we didn't have it on a slide, but the other options were recreation centers and sports facilities, and nobody really voted for that. I suppose maybe having something about that on a notice board might work. And nobody's yet mentioned the other piece. Community centers would be the same, would be getting some information out there. If it's a community health center, then again, the nurse, the doctors, primary care can talk about it. And in like local community centers, just having information about it would probably be a good idea. I just want to go back a little bit and talk about Interconception Health, which I already mentioned. So that's why, that can be done very well, because there's a number of visits happen between the birth of one baby and the next. So there is the mother's 6-week checkup usually, but there's also other options, such as if parents attend CAP-C programs or early years centers, parenting programs, have home visiting, involved with home visiting programs such as Healthy Babies, Healthy Children, midwifery appointments following the birth, and if they have had a doula or have a postpartum doula. All these are options where the reproductive life plan can be brought up, and it can be beneficial to the next pregnancy, the next baby, the health of the mother, the health of the family. So from there on, how can you envision using or disseminating the adult reproductive life plan in your work? And I'm going to switch to a discussion. Yes, so I've got this down as a discussion piece, and we can put a few things on here. So I can write on this, and if you want to put things in the chat line, and this can just be words, quick bullets, quick things to point out, and we're going to gather them onto that discussion board to see what we'll bring together here. So we have about 10 minutes or so that we can spend on this. So if any of you use the adult plan, okay, yes, So Robin and her colleagues are typing that they can use it with Healthy Babies, Healthy Children clients from an interconception perspective. And I think often women are very ready, or couples are ready to hear it at that point, so it's really good. I'm going to put here plans to use, and at the top, how they used, if anyone has used it. So we'll put this in maybe in a bigger font, and then plans to use also in a bigger font. Okay. So we've got more people coming out with their questions or their comments. Okay, from Karen here, we've added the Adult Reproductive Life Plan as a resource in the Welcome to Parenting online parenting class. That's a great idea. In this online program, we have a class on planning the next pregnancy, and the life plan fits well into this class. So you already have it in there. That's really good to hear. Plans to use, so added to online parenting class. Girl Guides of Canada, here's a message from Lisa. Rangers and the Rangers would likely work well in some of their program work. Yes, that's a really great idea. Those sort of organized programs, that would be really good. And both for the younger ones, the youth, and I think for, I mean, it goes right up to the Rangers program that would probably use the adult plan. Girl Guides. I'm just, and the adult reproductive lifeline, Kathy has used it in social media. Wow, that's really great. Tweets, Facebook posts, that's really nice. Good. And do you get a response, Kathy, as well? It would be nice to have it as an app. So if somebody has money and can make it into an app, I think people would really love that piece. Okay, Chelsea, we have a link to both plans on our website as well as Reproductive Life Plan banner on the website. Yeah, that's good. So that would be health unit promotion, right? Oh, that's half used. Yeah, so anyone going to the health unit website for whatever, whether it's, you know, advisories of some kind or some kind of information, will see the web banner pop up and has access to the plans. Okay, so Kathy's saying they haven't had any comments as yet on the adult reproductive life plan because it probably hasn't been out for that long anyway yet. But we've had comments about preconception health in general, and they may have been generated from those. So that's interesting to hear. So is any of that being used outside of Ontario? I see we have a few people here that are not from Ontario. Any comments there? Has anyone used something other than the reproductive life plans from the Westside Research Center? The U.S., there's quite a few developed, and we actually used one of theirs sort of as a template, as a starting point when developing the youth reproductive life plan. So, and what about, well, there's people typing. Jason from Alberta, okay, is typing. We have a reproductive life plan linked on our website. Okay, so here's one from Alberta, so it'll be interesting to take a look at that, but I'm hoping to make a more interactive or user-friendly version in the future. Okay, well, good to hear. Yeah, so what was I going to ask there? Is if people can think of, especially the primary care and the college and universities, how can we get into there? What would be some good steps? What, you know, the youth working with the school board, I think, is a really great way to work because there is curriculum that sort of it complements the curriculum, so that's a really good way to get it out. But for adults, it's much harder to reach them. So if somebody's got some good ideas how we can reach I'm going to put that as a third bullet point down here. Actually, I'll make it 2 points. Primary care. And how can we reach colleges and universities? Because I think that's not super easy. And in the meantime, I think we're getting a few more chat pieces. Okay, so work with cold chain nurses to distribute and inform primary care providers. So what are cold chain nurses? I'm a little bit uninformed there. And we assess, we're hoping to partner with the college's new health and wellness coordinator. Ooh, that's a great idea. What if it could go into orientation packages? So this is, okay, let's put this here. Okay, complete annual inspections of storage of vaccine. Ah, okay, that's what they do, the cold chain nurses. Ah, all right, that's interesting. And they have a lot of, yes, I would imagine that. So I'm going to put that here. Work with cold chain nurses, now that we know what they are. Okay, and we have, yes, we have a couple more people typing, so we'll do 2 more minutes and then we'll return to our slides. So we've got some good ideas, some plans to use. We've got some things that are already happening. We have one idea on how we could reach primary care and one idea on how we can reach colleges and universities. For the youth, Holton says we could partner with OFIA, yes, the Curriculum Resource Center, to have it linked to their curriculum for teachers. That's a great idea too, yes. Okay, link to there. Oh yes, and Lisa's saying, I just checked on our website, we have a link to the Health Before Pregnancy workbook only. I'll make the suggestion to add these resources. And I just want to tell you that we are in the process of revising the Health Before Pregnancy workbook. It will have a bigger section on interconception care. And I had that written down somewhere, what else is new, but I don't see it on my desk, so I don't have it right in front of me right now. It will be out sometime this spring, the revised version. So it's changing the language a bit from the sort of casual, slightly, funny sort of language to a more professional way of talking, and it includes, or is adding a couple of topics that were sort of missed. One of them was interconception in the old one, and making a few other changes. So that should be ready, late spring probably. All right, here is a piece from Karen. Could you speak at health professional workshops? Yes, pharmacists, but using the plan to promote interconception health. That's a really good idea. Present at at workshops and conferences. I'm just putting the pharmacists separately. Okay, yeah, that's good. And Kathy says we're meeting next week with the health promoters in the post-secondary schools in the GTE and hopes to work with them in promoting the adult reproductive life plan as well. So that's post-secondary school, health promoters in post-secondary schools. Good. Okay, so I think we've kind of exhausted that, and we are going to go back to our slides. All right. So I want to tell you a little bit more about the life plans. And one of them was that both of them were field tested with the one with young teens, like youth, and the other one was field tested with adults. And both had very positive results, but there are also some cautions. So I'm going to just tell you about the positive results first, and then a little bit about the cautions. So that's a little bit to think about too as you're thinking about disseminating. What people really liked on both of them were the literacy level, the images, the content, the resources that they were linked to, like the websites and different things that were mentioned. So those were all received really positive results. For the adult reproductive life plan, there were some cautions around it didn't seem particularly suitable to the LGBTQ populations and also the indigenous population. So both of them felt that it wasn't totally representative of their situation and their population. I think in the youth, in both of them, we tried to address a bit of the LGBTQ population with, one, the images, and two, a little bit in the relationships piece, but it still probably doesn't fully address that. So that's something to think about when you're using it with those types of populations. There may be some adaptation that may need to happen at some point. The youth, I think there were some questions about the cultural and sexual context that they were maybe using it in, for example, the Catholic school board, because it was also shown to teachers, and we tried to address all of their concerns right when it was done. So it seems to be that they are quite okay with that, but I haven't really heard from the Catholic school board that any of them has accepted it. It seems to be mostly so far the public school board, so that would be a little caution there, but I think it'll just be interesting to see if and how or when somebody accepts it in that kind of field. So that might be something to watch out for. So, and really also we had planned this webinar until 2:30. I don't think we're going to need the entire time because we're pretty much almost at the end, and I just want to give this a little bit more time for questions and anything that you may have. So we've got another 5 minutes right now for questions and can finish at 2. So I just want to say that from Mallory and Johnson, 2011, the research that they did, they found that these are two really key things that we have to consider when we talk about preconception health. So women must feel in control of factors such as contraception use, initiation and continuation of sex, perception of childbearing and motherhood, and that's why there may be some populations where a life plan doesn't fit, because it may not fit. Like if you're working with the Amish population that may just totally not fit, or with other cultural or religious groups that may not fit within their life view or their life picture. And some populations may believe that planning a pregnancy is not within their control, and that really is kind of saying the very same, similar thing to above. And it's often so within religious groups, but also in other groups, or women may just have that as their own belief that is not something that they can plan. So those are things to consider when we're working with a life plan. The majority are probably fine with it, but there will be women, there will be populations that just doesn't fit with. So that's what we just wanted to kind of say there, and then we have a few minutes. We're going to talk about equity considerations. So what are some of the issues you might have to mitigate when using the reproductive life plan? So remember what people have to have, for example, access to primary health care. If your clients are not insured, or if it's difficult for them to get to see a doctor, or they don't have a primary health care provider, so it may be, or there's no access to free health clinics or sexual health clinics, that can be difficult. What other things could be difficult? So we have one problem could be access to primary health care. The other one could be access to contraception. That could be difficult, and that's sometimes more so in youth too. And then access to affordable healthy foods can be difficult, because in both life plans we're talking about healthy eating, physical activity. So access to space for physical activity, access to multivitamins with folic acid for women specifically, that can be difficult. Access to specialized treatment for chronic conditions, mental health and addiction. So, and I just wonder if you want to add a little bit and see if you can think of any other things that might have to be discussed or supported when you're talking with individual women about reproductive health plans or individual persons. Infertility, yes, that's a really good point. Yes. And that's actually something we haven't really fully addressed. I mean, plans make it seem that whoever wants to can become pregnant, and that's just not always so. So it may just be something that needs to be addressed as well. Difficulty navigating the healthcare system for newcomers. Yes, exactly. That can be very difficult. And, like for a lot of people it can take time to really understand the healthcare system. It often isn't, and it's easier not to go at all. Having translated resources, yes. Yes, if we had additional funding, it would be great to translate these into multiple languages. Yeah, so those are all really good considerations. I don't know, I know with the youth we had a few, maybe not immediate newcomers, but a couple of young people who were immigrants, but had already been here for a few years. So again, newcomers might be an area where we haven't really fully done any testing on how well this fits. So if anyone is still typing there, then if everyone wants to just think about it for another minute and see if you've got any questions, or if we've covered everything. So when we're all done the webinar, I will send probably later this afternoon a link with the evaluation. I will send the slides as a PDF, and I will send the notes from our discussion. I will send those in a little Word document as well, so that we have all of those and can take a look at them. And I'd be welcome to hear if you have any other ideas, any other thoughts, any other questions. And I definitely would like to hear if you're doing anything out there and you're having success with it. That would be really good, and it would be great to share that at some point. So, and I think it doesn't look as if anyone has any questions, and we've done a fair bit of discussing already. So all I really have to say then is thank you to everyone for being, even though I know with chat line and webinars it's never quite the same, but a fairly lively discussion, and for all your support with this. And as I say, I'd love to hear from you in here if you've got anything to add. And this afternoon we will get the webinar evaluation, and here's my email address and my telephone number if you would like to contact me for anything. Thank you.